High TSH but normal T4. What does it mean? If your blood test shows a high TSH but a normal free T4, you may be wondering, why is my TSH high if my T4 is normal? This pattern usually fits subclinical hypothyroidism, sometimes called mild or borderline hypothyroidism. TSH is produced by the pituitary gland. It tells the thyroid gland to produce thyroid hormones. A high TSH means that the pituitary gland is sending a stronger signal. Because free T4 remains normal, the thyroid is still producing enough hormone. In simple terms, the thyroid is still keeping up, but it needs more stimulation to do so. In subclinical hypothyroidism, TSH is high and free T4 is normal. In overt hypothyroidism, TSH is high and free T4 is low. Some people call this a sluggish thyroid. However, subclinical hypothyroidism is the more accurate term. This does not always mean that medication is needed. A mildly elevated TSH may be temporary. In this video, we will discuss symptoms, repeat blood tests, TPO antibodies, weight gain, levothyroxine, and when a high TSH with a normal T4 should be treated. So, why does TSH rise before free T4 becomes low? The pituitary gland continuously monitors thyroid hormone levels. When the thyroid becomes slightly less efficient, the pituitary gland releases more TSH. This stronger signal makes the thyroid work harder, allowing it to maintain a normal free T4 level. Therefore, TSH often becomes abnormal before free T4 falls. A simple explanation is the thyroid is still producing enough hormone, but it needs a stronger signal from the brain. If thyroid function worsens, TSH may continue to rise, and free T4 may eventually become low. However, this does not happen in everyone. But is this always subclinical hypothyroidism? Not necessarily. A high TSH with a normal free T4 fits the blood test pattern of subclinical hypothyroidism. However, one abnormal result does not always mean permanent thyroid disease. The result should be interpreted according to several factors. These include the actual TSH level, the laboratory reference range, previous thyroid results, age and pregnancy status, recent illness, medications and supplements, and any previous thyroid treatment. If someone is already taking levothyroxine, a high TSH may indicate an insufficient dose, missed tablets, poor absorption, or an interaction with iron, calcium, or other medicines. Biotin supplements can also interfere with some thyroid blood tests. Always tell your healthcare professional about any vitamins, supplements, and medications you are taking. Can a high TSH go back to normal without medicine? Yes. A borderline high TSH with a normal T4 may return to normal without levothyroxine. Possible temporary causes include recovery from a recent illness, normal biological or laboratory variation, temporary thyroid inflammation, certain medications, changes in iodine intake, supplement interference, and changes in body weight. A TSH between approximately 5 and 10 may return to normal in a significant number of people. A TSH above 10 is less likely to return to normal without treatment. This is why doctors often recommend a repeat blood test before diagnosing permanent thyroid disease. For a stable adult who is not pregnant, TSH and free T4 may be repeated after approximately 3 months. Pregnancy is different. Anyone who is pregnant or trying to conceive should seek medical advice promptly. What are the common causes? The most common cause is Hashimoto's thyroiditis, an autoimmune thyroid condition. In Hashimoto's thyroiditis, the immune system gradually damages the thyroid cells. During the early stage, the thyroid may still maintain a normal free T4 level, but the TSH rises. Other possible causes include previous thyroid surgery, radioactive iodine treatment, neck radiotherapy, thyroid inflammation, lithium, amiodarone, some cancer immunotherapies, excessive antithyroid medication, excess iodine exposure, and inadequate levothyroxine treatment. A TPO antibody test can help identify autoimmune thyroid disease. Can a high TSH with a normal T4 cause symptoms or weight gain? It can, but many people have few symptoms or no symptoms at all. Possible early signs of an underactive thyroid include tiredness, feeling cold, constipation, dry skin, hair loss, mild weight gain, muscle aches, poor concentration, low mood, and heavy or irregular periods. However, these symptoms are not specific to thyroid disease. Tiredness and weight gain may also be caused by anemia, poor sleep, stress, menopause, medication side effects, or other medical conditions. Therefore, a high TSH with a normal T4 does not automatically explain weight gain or tiredness. If levothyroxine normalizes the TSH, but the symptoms remain unchanged, another cause should be considered. What does the actual TSH number mean? The degree of TSH elevation is important. If the TSH is above normal, but below 10, this is usually considered mild subclinical hypothyroidism. It may remain stable, return to normal, or gradually worsen. Treatment is not automatically required. The decision depends on symptoms, age, TPO antibodies, pregnancy status, previous thyroid treatment, and whether the TSH is increasing. If the TSH is 10 or higher, persistent elevation is less likely to return to normal. It is also more likely to represent significant thyroid dysfunction. Levothyroxine is commonly considered when the TSH remains at or above 10 on two separate blood tests. TSH interpretation also varies according to age, pregnancy status, and the laboratory reference range. What additional tests are needed? The first step is usually to repeat the TSH and free T4 tests. A TPO antibody test may also be useful. What does a positive TPO antibody test mean? A positive TPO antibody result suggests autoimmune thyroid disease, most commonly Hashimoto's thyroiditis. It also increases the likelihood that thyroid function may worsen over time. However, positive TPO antibodies do not automatically mean that treatment is required. The decision still depends on the TSH level, free T4 level, symptoms, age, and pregnancy status. TPO antibodies usually need to be checked only once. The clinician may also review previous thyroid results, cholesterol levels, medications, biotin supplements, kelp, and iodine supplements, family history, and previous thyroid treatment. A thyroid ultrasound is not routinely needed simply because the TSH is elevated. An ultrasound is more useful when there is a thyroid lump, a thyroid nodule, thyroid enlargement, or another structural concern. So, do you need levothyroxine? Not everyone with a high TSH and a normal free T4 needs treatment. Levothyroxine is more likely to be considered when the TSH remains at or above 10. The TSH is progressively rising. Symptoms are significant. TPO antibodies are positive. There is a goiter. There has been previous thyroid surgery or radioactive iodine treatment, or the person is pregnant or planning a pregnancy. For adults under 65 with a persistent TSH below 10 and possible thyroid symptoms, a trial of levothyroxine may sometimes be considered. If the TSH becomes normal, but the symptoms do not improve, the symptoms may not have been caused by the thyroid. Treatment is approached more cautiously in older adults. Too much thyroid hormone can suppress the TSH and increase the risk of complications, such as atrial fibrillation. Pregnancy requires a separate assessment and usually has lower thresholds for treatment. What should you do next? Do not panic, but do not interpret the result in isolation. Check the exact TSH and free T4 values. Compare them with the laboratory reference ranges. Review your previous thyroid results. Discuss your medications and supplements with a healthcare professional. Consider checking TPO antibodies. Repeat the TSH and free T4 tests when advised. Discuss treatment if the TSH remains elevated, particularly if it is 10 or higher. Seek medical advice earlier if you are pregnant, trying to conceive, experiencing significant symptoms, or already taking thyroid medication. Do not start iodine, kelp, or unregulated thyroid support supplements. Excess iodine can worsen thyroid dysfunction in some people. If treatment is not required, thyroid function can be monitored periodically. The main takeaway is this: a high TSH with a normal free T4 usually means that the thyroid is still producing enough hormone, but it requires stronger stimulation from the pituitary gland. This pattern is called subclinical hypothyroidism. It may represent early thyroid failure, particularly when TPO antibodies are positive. However, a mildly elevated TSH can also be temporary. Treatment should not be based on one result alone. It depends on the repeat blood test, the degree of TSH elevation, symptoms, age, TPO antibodies, medical history, and pregnancy status. The key is to interpret the result in its full clinical context, rather than assuming that every high TSH requires lifelong treatment. If you found this explanation helpful, please like the video, subscribe to Dr. RRJ Health, and share it with someone who may benefit.